Well, hello and welcome to all of our viewers from around the world. I'm Fiona Langsharp, IBCLC Director of Communications and MC here at GOLD Lactation. Welcome to everyone joining us here today. We are talking with Dr. Anya Kleinman, who will be speaking at our upcoming GOLD Lactation Conference. Now, this conference is coming up right away. April 4th is our opening keynote date, where we'd love for all of you to come and join us. You can go to the website right now and join us on that day for a free presentation with Melissa Cole. Now, during the rest of the conference, we have some incredible speakers, including Dr. Anya Kleinman, who's going to be talking about building bridges, early IBCLC recognition, and triage of common and life-threatening newborn and maternal pathology. Well, welcome to you, Anya. It's so good to have you here today.
Hi, thank you so much for having me.
Well, I was delighted to see that we had this presentation as part of, the whole conference, because we have already talked about how important this early detection is in saving lives. And I know you're going to be talking a lot about that, and we'll get into the topic in just a few moments. But I would really love it if you could introduce yourself, tell folks where you are in the world, what you do, and kind of what life looks like for you on a day-to-day.
Sure, thank you so much. So I am the mother of 3 little boys who are 8, 5, and 2, and I work as a general pediatrician in a pediatric emergency room, taking care of children of all different ages, including brand new babies and their moms, in the Northeast Ohio area.
Wow, that's incredible. And as I was thinking about, your specific practice, you're really taking a lot of acute cases in every day. Is that right? Like that's what you see?
Yeah, a lot of what we take care of, it's a privilege to take care of young infants in a range of acuity, but a lot of the children that we see are quite sick, but then some of
Mm.
them are worried well, and that's a great opportunity to educate and have conversations with mothers and fathers and their babies about breastfeeding in those first couple of months.
Yeah, absolutely. I can imagine that there's a lot of counseling that happens in those very heightened moments, because they're coming to you with these perhaps sometimes dire situations and problems, and this is now for a lot of them, their anxiety would be really intensified from the situation. So how does that lend into, your skills as a mother, that you have these 3 little ones? Is, I can imagine it's very relatable at times.
Oh, for sure. I think both interact and make me better at each of the 2 roles that I have in my life. I definitely think I am a much more empathic pediatrician because of my role as a mother, having been sleep deprived 3 times over and breastfed 3 of my 3 young boys. I can definitely sympathize with how difficult it is and how anxiety provoking some of the challenges are when your baby's been crying and you don't know what's normal or abnormal. It's really helpful to have somebody to talk to who's potentially had that same experience and can reassure you.
Yeah, absolutely. Yeah. Having that empathic person in your midst must be just, I mean, it's just such an honor, to work both ways when you're working with a physician, because it is so scary as a parent. Many of us have been, ended up in the emergency room at some point, and, we don't go there lightly. We are, in a dire situation. So tell me a little bit about your story. I'm so curious, because you are an IBCLC as well. And how did that all come about for you, Anya? Was this something, which came first, and how did you find that path?
Yeah, no, that's a great question. So I actually was, I had my oldest son when I was just about finishing my pediatrics training. And in the process of becoming a new mother and the challenges of breastfeeding, I came to realize that I really had significant knowledge gaps, even though I was a physician and even though I had had formal training and some breastfeeding education. And I think some time has passed since I finished my training, and there's more and more education of physicians and more awareness, but there's still a very large gap in medical knowledge and expertise in breastfeeding medicine. But in recognizing those in myself, I tried to kind of fill those gaps, and in the process became really fascinated both through the positive experience of my own breastfeeding, but also just noticing how much doctors can help, but also some of the mistakes that we make in being overly conservative or cautious. And so that prompted me to learn the material for the IBCLC and then sit for the exam. And I
Oh,
honestly
that's
find that information
fantastic.
is, yeah, thank you. It's so helpful in my interactions with families, even if they're not necessarily coming in for a breastfeeding question. Very few people come for a lactation consultation to the emergency room, but often it's something that's happening in a question they have.
Yeah, no, that's fabulous. I was just thinking about a pediatrician I know locally here, who's an IBCLC. And of course, I'm not an MD, but we speak the same language, so I can go and share a client's concerns and see if it needs, further attention from a medical point of view. It's just a fantastic way that we can collaborate on on that level, and they can, take care of all the other medical things that, of course, I wouldn't be able to do. But I just find it such a wonderful, wonderful relationship. So kudos to you for taking it a step further. I love it. I really do.
Thank
It's
you.
just fabulous. Um, Tell me about the peers that you work with in your midst then. So, I know there's plenty of pediatricians and family doctors that are still kind of, walking this fine line of perhaps wanting to have the knowledge or not quite being there, trying to figure out if it's important enough to, maybe get into lactation. So do you share some of that knowledge? Like if you seen other pediatricians or MDs join that sort of that path with you?
Yeah, I definitely do. So I think medical training, especially pediatrics, but also family medicine training, enables us to have a lot of patient care hours. And so I think many I teach a lot of different residents, family medicine
Oh,
residents,
yeah.
emergency medicine residents, and pediatrics residents. And I especially focus on the first two groups because I find that their formal training and didactics don't necessarily include breastfeeding medicine, but of course they're taking care of lactating
Sure.
parents and young babies. And so making sure that they understand how important and how impactful those conversations are. I think many of them are still early on in their family careers, and so many of them
Right.
have not yet had children, and so they often minimize or just are not yet aware of the importance of even small conversations and framings of, do you think you have enough milk, do you want to give formula, all of those conversations and how important they are even for decades down the road in terms of people's memories of those formative years with their children.
Well, you're laying the foundation for them. I mean, that's the thing, right? I mean, it is true. Sometimes we don't think about all the different nuances until we become parents, or how important those questions might be to us in making decisions, right? We all want to make that informed decision, but sometimes that informed decision changes, throughout our parenting, I find. So, and then as of course in our careers as IBCLCs, it can also obviously change as well as we get more experience.
Of course, for sure. And I think recognizing the value of validation is really
Mm.
something that I think medicine is still working on. And just having, the recognition of how difficult and how important the things that these parents are trying to do for their children are, can go really far, especially during a global pandemic when their life is already
Mm.
difficult.
Oh gosh, yes, so many things to take into consideration there. Absolutely. All right, let's dive into your topic. I mean, it's almost like so juicy because because it is about all those critical things that can happen. And and I know that you're the emphasis on, that they could become life-threatening. So again, the title of your presentation is Building Bridges: Early IBCLC Recognition and Triage of Common and Life-Threatening Newborn and Maternal Pathology. So tell me, how important do you feel that this topic is? Well, I know you're covering a few things, but thinking about the IBCLC, I always say that sometimes the IBCLC is sort of the first person to sort of sit with a patient, and hear the whole story. So is that why you think that this is probably a fairly important topic for the IBCLC?
Yeah, I completely agree with you. I think in the same way that physicians can build their knowledge in breastfeeding medicine, it's very important that everybody who's caring for young babies and their parents has a sense of what's normal, what's not normal, and within the not normal, what's really life-threatening or potentially life-threatening. And I think many of the conversations are most honest and most direct with lactation consultants since they are so trusted. And so it's an opportunity to recognize things within the baby and the mother that maybe
Mm.
in the span of a short visit in the busy time after postpartum may go unnoticed by somebody else.
Yeah, I've often found myself, there is sort of an unraveling when I see clients sometimes, especially if it's an acute patient who hasn't seen myself prenatally. So they're phoning me in a crisis, because they've reached kind of the end of the road. And it reminds me of clients that I just saw recently who were told that their baby was dehydrated and they were going to have to switch to infant, formula, which was enough to trigger them to call me. But yes, I mean, they start to really unravel, when they're with you. So I just love the idea of making sure that when we are hearing the stories, that we can put all the pieces together. I feel like some of this conversation with you is going to be some of those critical missing pieces that then can lead to, developing, an eye for and an instinct for some of those challenges, and then being able to immediately refer out or, address it with the parent to say, you need to go back in, you need to talk to your physician or whoever's been immediately caring for them in the medical field. So one last question as we wrap up here, just thinking through this process, and how many times have you seen this sort of happen in your midst, where you've seen an IBC refer back to you, or in your community? Do you see those sort of things happen, Anya?
That's a really good question. I do occasionally see it. I think I definitely have taken care of children who were born outside of the healthcare system and
Right.
then came to medical attention when things were further along than they could have
Mm-hmm.
been had that not been the case. And some of that was medical distrust, some of that was just logistics. But I think lactation consultants sit in a very trusted, very
Yeah.
open place in the world. And so many people are much more comfortable sharing with them
Mm,
their concerns. And so they may call their doctor, the doctor might be swamped, they might be on hold for a long
right.
time. Any and all of those things may happen,
Sure.
but they may reach out to their IBCLC as a point of contact. And so just having that extra bridge, I think there's so much going on in the postpartum phase that as many helping hands as we can have, the better.
Sure. Oh, well, you just gave me goosebumps all over, because it reminded me of the bridge. I love that term, is that we can help with that bridge and support it, and have some of that knowledge sort of in our toolkit, in order to refer back. And you're right. Sometimes it's a mistrust, but with the medical system, but often it's just, an organization, that they need someone to be direct with them. And I think IBCLCs know how to do that. They know, if there's something not right, and they can, have that critical eye. Well, this is going to be great, because I think that the more IBCLCs that have this knowledge, you're right, the more we can bridge the gaps between, the relationships, and, get people where they need to be when they need to be.
Agreed.
That's
Thank
wonderful.
you.
Yeah, thank you so much. It's been so good having you here, and honestly can't wait for this presentation. I think that this is going to be a great, learning spectrum for so many of us to sort of get into, and I'm sure that there's going to be lots of conversation on the day. So just a quick reminder, you're going to be with us live. I know you know that, but for all of our audience listening in, Dr. Anya Kleinman is going to be here live, which means that you'll have an opportunity to have a great conversation, ask questions, dive into this topic even more. So don't forget to check out the website at goldlactation.com. You can see all the listings for your local times there, and we'll look forward to seeing you then. Now, if you have to miss the day, don't worry, you'll be able to listen to the recording. And of course, we'll have the live forums throughout the conference for you as well, where you can also post those questions too. Well, thank you once again to Dr. Anya Kleinman for being with us here today. And of course, to all of you, our viewers. Bye-bye for now, everyone.